Great, thank you. Thanks very much. And good evening to everybody. I start off by saying that can you make a difference as a health researcher is not specific to my discipline in oral health or dentistry. So I think it does apply across the health spectrum. So those of you who might be interested in health research, hopefully this will have some meaning for you. It's not just specifically clinicians, but it can be people in the with a science background. In fact, some people from a social sciences or arts background can sometimes have a place in health research as well. So I hope that my talk over the next few minutes will give you some thoughts about that. So just a quick background to myself. I'm a practicing clinician. I'm a dentist. I manage disease. I manage tooth loss in older adults primarily. And you can see from this set of photographs, there are many different problems that people run into over the course of a lifetime. And as a researcher, I want to find ways to do this better and how to improve quality of care and patients' quality of life. That's basically why I'm interested in research and why I trained as a researcher as well as a clinician. So I think if you think about teeth, this photograph is downloaded from the net, but it's all about smiles, right? That's all we care about with teeth. And I hope that you'll probably recognize some crazy images you see of people who have strange attitudes and strange cosmetic desires. And of course, teeth and smiling and everything is very important. But actually, it's a lot more than that, because when you lose your natural teeth, it has a big impact on your ability to chew and your ability to speak. And when teeth are lost, it's very difficult for us to replace them. This picture here is a picture of George Washington's teeth, which you can see in the Smithsonian Museum. And funnily enough, when you lose all of your natural teeth some 200 years later, the most commonly prescribed form of treatment is not really that different. So it tells you how hard it is to actually replace teeth. So why is this a big issue? Why is it important? Well, as people get older, we recognize through research that actually not being able to chew things properly has a big effect on your health. And one area, for example, is the area of sarcopenia, which is loss of muscle mass as you get older, and a significant contributor to frailty in old age. And we know that not being able to chew things contributes quite a lot to that. We know that having unhealthy teeth in old age, if you're frail, it can actually, in some cases, cause you to die. You can actually get bacterial pneumonia if you're very frail and ill with other conditions. And if your mouth looks like these photographs here, then you could have a high risk for mortality, or at least prolonged hospital stay, which is very, very expensive. And patients in the yellow box here in the bottom right are the ones who would tend to be the bigger risk of this happening to them. So having a lot of oral disease is not a good idea. And dental disease is actually very, very common. It's actually the dental decay, where you get fillings required for your teeth, is the most prevalent non-communicable infectious disease in the world. It affects around about 4.5 billion people. Gum disease, which is where you lose the support structures for your teeth to disease, which is a very common disease as well. It's about the 6th most common. So it affects an awful lot of people. And the mouth is the entry point into the body. So things that you need to do in terms of food and chewing and everything have to go past the mouth first. And if you've got problems in this area, and many people do, they get loss of teeth and lots of decayed teeth, they can't chew things properly, and that's going to have a broader impact. We know that if you have a good mouth and healthy disease-free teeth, you're able to chew things better. You don't need to have special preparations of your food. But if you don't and you lose your teeth, then you lose your biting power. And we know that from our research that a lot of people who have no natural teeth have quite a poor diet. They actually have higher cholesterol levels. They end up with lower levels of vitamins, and this is going to have an impact again on health. And so we know there's a sliding scale. The more teeth you have, the better you are. The fewer teeth you have, the worse off you are. And this is repeated in research all over the world. We know a lot more about this relationship now through research than we do through pure clinical practice. And it's the same in France, in Canada, in Taiwan, in Brazil, and everywhere. These are just research that tell us this relationship is an issue. Another area that it's important is the common risk factors for other disease states. So a big health concern in Singapore at the moment is the growing obesity levels. And we see very rapidly growing obesity now in younger men in particular. But we see a common risk factors with dental disease. So people who tend to have poor quality teeth and dental disease at a young age will often tend to be overweight as well. So obesity is associated with fewer teeth and problem-based dental visits. So there are common mechanisms or interaction between these states that we explore through research and try to understand more about. And this is another topical area is the diabetes phenomenon. So sadly, Singapore has a very high diabetes prevalence. And we know that things like sugar are a common risk factor for dental disease as well as diabetes. So there is this relationship which we study. We look and see, for example, there's a relationship between gum disease and diabetes. Now, not every person who's gum disease will be diabetic and vice versa. But commonly we see that there are people who've got both conditions. And we're exploring through research areas whereby if we improve the health of one part of this, does it affect the other part? So for example, if you improve your gum disease, does it have a positive effect on your diabetes? And we are seeing some results that show, yes, it can certainly help. We don't fully understand that yet, but we certainly are looking at both of these conditions simultaneously now in our faculty and in other areas. So how does dental disease manifest itself? Sorry now for those of you who've just eaten, but if you look at the right-hand side, this is clearly somebody who would get a ticking off from us as dentists because they don't brush their teeth very well. But you can see the white gooey stuff is what we know as plaque. We also describe it as a biofilm, and this is a very complex ecology. This is where you've got multiple different variations and species of bacteria. You've got a lot of sugar substrate in there, and the bacteria feed on the sugar substrate. And if you're susceptible to disease, and not everybody is, but if you are susceptible, then you will see things like dental decay on the left side of the screen and periodontal gum disease on the right-hand side of the screen. So the way to think of this is it's a fairly simple equation in some ways, but that actually undermines the complexity of this process. But it's bugs feeding on sugar with some host susceptibility. Over time, it will lead to disease. So we're very interested in biofilms and how we can disrupt them, how we can interfere with the bacterial mechanism of interaction in these biofilms. Some of you I just added for completeness, but some of you will have heard of this term dental implants. It's very topical. It's a way that we use to try to secure prostheses in people's mouths when they have lost teeth to dental disease. And guess what? Biofilms negatively affect dental implants as well. So nothing is for life that we have to place in someone's mouth. In this picture here, you can see on the bottom left-hand side, a biofilm has colonized this metal, which is a dental implant, and the bone around it has disappeared. So this implant, unfortunately, is failing and will have to be removed. So biofilms are a big issue, and we are very interested in them and how can we improve the prospects for people by interfering, if you like, with these biofilms. Other areas that we're particularly interested in is when you lose teeth, you lose bone as well. And actually, oral tissues are very hard to replace. Our standard mechanism of doing this for the past 100 or so years has been using mechanically made prostheses. And these all have a lifespan. Our holy grail has been to find a way to grow tissues back. And we've not been able to do that fully with teeth because the substance here at the top, the enamel, you can't grow. The structures internally in the tooth, you can develop in the lab through scientific methods. And this is an area that one of our teams are working on that I'm going to talk about a little bit later. So ideally, yes, we would try to grow tissues back in a safe way, in a predictable way. And we're looking at a number of mechanisms to try to do that. And I'll come back to this a little bit later. So it's not bad. We can do this with the prosthesis. That's the same patient, but that has a lifespan. So this is the tooth here. It's the middle one in the screen in the upper jaw. We can do nice things with planning with three-dimensional imaging now, and this is an area that is also subject of a lot of research. Can we actually accurately plan out surgical procedures using three-dimensional imagery like this one here? So if I draw your eye to this image here, you can see there's a gray shadow. That's where all the bone is missing. The yellow is the bone, the gray is not bone, it's space. So where we want to replace the teeth is where this bone is missing. So we know we have to get more bone. If we look at this reconstruction, we can plan all this out. So the pink part here is the size of the bone that we need to find through a graft that we can pin on to the green part, and then we can put the lighter green part in, which is dental implants. Now, if we can plan all this out from a computer and decide, we can print templates for this to guide the surgeon on how to do this work, it makes it much better for the patient and much more predictable. So this is something that we do a lot of work on in our clinics, and we work with Additive Manufacturing NUS or AM.NUS to design different forms of printable devices to help us with our surgery for this type of complex surgery. So I guess, having just kind of given you a very quick walk through some of the challenges that we face when we're trying to work as dentists and where research can actually help us and help us improve patient care and quality of life. I hope I've been able to show you that dental disease is quite problematic. It can lead to a lot of other consequences other than just bad appearance. There are a lot of common risk factors with major chronic diseases such as diabetes. And these risk factors you're exposed to from the moment you're born to the moment you die. So you're at risk of developing this all the way through your life, and it can get worse as you get older. Local effects include pain and discomfort, and tooth loss is disabling with a major impact on quality of life and high cost to replace missing teeth. So why do I think you should come to our faculty or into NUS to study some of these areas? Well, we're part of a really good network of clinicians and scientists. Our clinics and our labs are not dissociated from each other. In fact, the building behind me there is the new National University Center for Oral Health. And the top floor of this is a wet laboratory. The building behind is the National University Hospital. The clinics below are where we treat a lot of patients. And of course, we're right beside NUS. So we're really in the heart of a very vibrant ecosystem for looking at clinical problems and trying to do research to help us solve those problems. We have what I describe as a bench to bedside to population research agenda, which is undertaken in really world-class clinical research facilities. And in addition to our clinical programs, we offer Master's Bioresearch and PhD programs to people, not just dentists. Actually, we're looking for more people outside of dentistry because some of these are not just dental issues. The science that you develop in our labs will actually have applications across other areas of healthcare as well. And I'll talk in more detail about a couple of these shortly. So we have basically got three platforms, laboratory or wet lab bench research, and we have stem cell and tissue regeneration research team. We do a lot of work with microbiology and biofilms, and we have a biomaterials research group as well who work with, amongst other people, the 3D Graphene Center in NUS. As in a clinical environment, we run clinical trials where we take some of what we've learned in our labs and bring it to clinics. And then at population level, we do a lot of work now with the School of Public Health, for example, in terms of oral epidemiology, disease surveillance, and health services research. So we're right across the whole spectrum. And as I say, we're really trying to use our research to improve not just oral healthcare, primarily oral healthcare, but healthcare in general. And we honestly feel that we have a really excellent team of people to work with if you're a prospective research student, and you get a lot of support in our faculty to help you succeed. So let me run you through briefly a couple of the areas. I mentioned earlier that biofilms are an area where our focus in trying to deal with dental disease is how can we modify biofilms? How can we make them less pathogenic? And obviously one area is at a clinical level to get people to brush their teeth a little bit better and have a less fondness for sugar. But some people have a high susceptibility to dental disease and they need a little bit more help than that. So we have teams who are looking at trying to make biofilms not as the bacteria in them not multiply as quickly and not be as pathogenic that they will lead to dental disease. And one example of this is, some of you may have heard of the term root canal treatment. This is where you get an infection in a tooth, and it's very, very painful when you get it. So we have to do a lot of work to clean all that bugs and material out, but there's a possibility of it becoming reinfected. So we're looking at ways that we can introduce materials into the root canal system, and I have an X-ray here. We can see this white line, and this is the root canal, and this is a root canal filling. So our group in our school have looked at ways that they can introduce what we call bioactive materials into the root canal system. And this actually prevents the bacteria from re-multiplying, recolonizing, remultiplying, and reintroducing infection after treatment. So we've found actually that this phenadione material, it works very well to actually kill some of the bugs that lead to reinfection of the teeth. So we've shown that in the laboratory setting, and this paper was published a few years back, and we're now doing this in clinical studies as well. So this is an example where we take something from a lab and we translate it into a clinic, and we can do that in our facility because we've got both facilities. I mentioned a little bit earlier the dental implants, and dental implants are becoming more and more popular now. More and more people are seeking them, but we do have this problem with once biofilms colonize these threads, there's no cure for that. The implants will fail. So my colleague here, Associate Professor Vinny Rosa, has a big interest in this area. In two areas. On the left-hand side of the screen is actually trying to regenerate nerve tissue that it can be predictably implanted into a tooth and regenerated. So his group have been able to develop these from stem cells from teeth that have been extracted, and actually transplant this material into teeth, and it grows regenerates the nerve tissue. This is a relatively early stage of this science. His team are doing a lot of work in this area, but it's very exciting because if we can actually regrow some of the vascularized and blood vessels and nerve tissue, that has a big, big potential. Another area his team have been working on is using graphene. And I think earlier in the day, one of the inventors of graphene was speaking to the group. So this is an application of his science, taking graphene and coating titanium, which is the material from which dental implants are made. And what's very exciting about this is that implants are an implantable device. So basically you breach the skin and you breach the body's protection zone, which potentially leads it to introducing infection. And we see this in things like catheters, for example, or shunts. And it's a big, big healthcare problem. So what Vinny's group has shown is that when you put this graphene material onto an implant, and this is a lab-based study, these little photographs at the bottom right-hand side of the screen show that it actually stops the bacteria proliferating in the biofilm. And that's very exciting because that means they're not able to grow enough to become pathogenic and cause disease. And the other really nice thing is it does this without killing other cells around it. So this is a big breakthrough, and this was published last year, and I think there's a lot more to come from this, a very exciting area. Another really interesting area is my colleague, Associate Prof. To Weis-Young. And Weis-Young has been doing some wonderful work with exosomes. So this is an interesting concept. It's actually using these materials to develop ways of regenerating lost tissue. Now, his area has been mostly looking at cartilage, and cartilage is something you see in your joints, your knees, your ankles, your shoulders, and so on. And we also see it in the joints here at the side of your face. So he's done some very nice work to show that actually you can predictably start to regenerate some of these materials, which we didn't think you could regenerate in the past. These are animal studies. And he's also been working in an area to use these to reduce inflammation. So it's a way of modifying how the body's whole inflammatory response works, and it helps to reduce pain. So this is, again, a very exciting area and something very, very interesting. And his team work with the orthopedic surgeons and other areas in A-STAR as well. So this is really, really good. And my colleague here, Dr. Gopusriram, he's been working with stem cells. He's got this very nice project called Organ on a Chip. So this is trying to differentiate different forms of tissues, such as skin and mucosa. It's very difficult to do, but his lab has developed a number of techniques to develop this predictably. And we're now advancing this on to potentially into a 3D printing platform as well. So to scale up these things, it's fine just to grow them on a dish, but we need to actually scale them up to size that they can actually be implanted in people. So I mentioned earlier about the loss of bone and the loss of skin over the bone in a trauma incident, for example. We can maybe grow some of these things back, and we may be able to do bioprinting to manufacture these tissues from stem cells. So this would be something that can be very much applied in regeneration precisely to a particular patient. And that is an exciting area of work. And I think there's a lot of potential there. And he works again with his team across colleagues with A-STAR and again with NUS. Sorry, let me go back up one. So other areas, of course, if you can prevent disease in the first place, that would be fantastic. It's not always possible to do that because oftentimes dental disease is presented to us very late. But my colleague, Associate Professor Stephen Shee, and his team have been working with a project called the Gusto Project. It's quite a famous birth cohort study here in Singapore. And again, they've been finding some very interesting associations with very small infants and preterm babies. That there are some interesting interactions between people who are at risk of dental disease and people who develop, little kids who develop atopic dermatitis or eczema. Again, this is something we're looking at more and more to see, are there things that we can do pre-birth that might actually have an influence on disease trajectory post-birth? This is really cutting edge stuff. It's going to be a long-term project. He's always looking for colleagues to work with him on this and be part of a big world-famous project, the Gusto Project. He's actually even been on BBC World News with this a couple of years ago. In fact, he was more prominent than Roger Federer winning the French Open. Stephen, that's him here with this particular piece of work. So this, Stephen is a pediatric dentist, but he's working as not just a dentist, but researchers to try to tie up some of these interactions between dental disease and broader health conditions. And then finally, at the population level, we're very much interested in the determinants of health and the determinants of behaviors and attitudes and practice which influence oral health in the population. There's a big move now towards trying to shift the needle towards prevention rather than treatment. And to do that, you need to have a very vigorous program in the community about health promotion, about raising awareness of disease prevention, improving health literacy, being sensitive to the needs of the elderly, and health services research to show how you can get best cost effectiveness. So we have a group, the Population Oral Health Services Research Unit in the school, who work very closely with colleagues outside of the school, but also mostly with our colleagues in the School of Public Health. And we have many research students who are in fact not dentists, they're public health specialists or people who are interested in public health rather than the clinical domain. And we would certainly be very interested to hear from colleagues who are interested in this area. So just in summing up, I would say that look at us as part of an integrated health system. We have very big facilities. We work very closely across different institutes across Singapore. We do have international connections and networks as well. Difficult to do that right at the moment, but hopefully in time we'll be able to network people to people overseas as part of the training as well. And I hope that that has given you some indication that oral health and dentistry is not just about smiles and teeth. It's about a lot more, and where our research is very, very important in helping us to answer some of these very common problems that affect health in general. Thank you very much for listening.
Great, thank you so much, Professor Allen. I think at this point, we'll open the floor up to questions from any of the attendees. Again, feel free to raise your hand if you have a question, and I'll unmute you, and you can ask your question live. If there are no questions at the moment, while you think of a question, I actually had a couple of questions myself. The first is actually, I think, coming from sort of more economics training, I actually didn't realize that the Faculty of Dentistry had a lot of collaborations across many different disciplines. So it seems very much like you work a lot with engineers, people in the School of Public Health, as well as people in the medical faculty. And I think you mentioned quite briefly that in order to do a PhD in dentistry, you don't actually need to have a dental degree. Right. And so maybe a question that I have is then, in terms of prospective PhD applicants, what do you look for in terms of trying to decide if this person is going to be a good fit in the PhD program?
Sure. Well, I suppose the initial things would be, can we support the prospective applicant? Is their area of interest aligned to what we can support? And I guess if they fit into any of these categories I've just very quickly outlined here, then that's a very good start point. I think that, I think other speakers I'm sure have said as well, we look for people with passion who really understand that this is hard work, but very, very interesting and very rewarding, who would like to be able to work as part of a team, and the whole notion of why they want to do research, they have a good idea in their head what the purpose of this is. But I guess specifically, we would just firstly try to find, are their interests aligned to what we can support, and are they interested in an area of research that we have groups of people working in, because we don't want them to come in as just an isolated researcher trying to find their way on their own. That would be probably the main thing I would say.
Interesting. So it sounds like if for example you were more interested in the sort of like engineering aspects of like trying to manufacture, like trying to create some of these implants and stuff, if you had a very strong training in engineering and biochemistry, you could be a good fit even if you didn't have a dental degree.
Oh, absolutely. Yeah, absolutely. We're very keen, in fact, to disabuse people of that notion that it's just dentists that we're looking for. In fact, it would be more people who are not dentists actually is what we're looking for. And we're very keen to collaborate. So, for example, in some of the areas you've mentioned, it could be that a program will be co-supervised by colleagues in the FOD and another faculty. We're very open to that too. We have many examples of that, where we kind of co-supervise PhD across schools, across faculty.
Great. So there's a question from June. I'm gonna unmute her so she can ask this question live. Okay, all right. June, you're live. You have to unmute yourself.
Good evening, June. Are you there?
Hello. Sorry, I was actually yes, I'm here. Could you hear me loud and clear?
Yes.
I can hear you.
Yeah.
Yes.
So, well, I suppose I posted my question. I wasn't prepared to speak. But yes, just got connected. So I think what got me interested was when you put up the slide to say for health researcher. So my research area, what struck me as interesting was I was actually looking at the elderly care for the elderly, and re-looking at how potentially, we can redesign that experience in Singapore. And as you were kicking off the presentation, so I was keen to find out what would you advise mid-career professionals like myself to explore a PhD in dentistry. Really, the background is more in social sciences, in looking at the human interactions with the current healthcare system in Singapore. So I'm not sure whether that's remotely even what you'll be looking at. So out of that 4-quadrant, probably the research or the educational piece is something that I'm interested in.
Sure. Thank you. Thank you for the question. I mean, the areas which sound as if they may overlap with yours would be in the population oral health research unit that we have, because here we're quite interested in things like the determinants of health and the impact and quality of life, for example. And we do have a number of projects, in fact, where we're looking at this in elderly populations in the community. And we have a number of areas where there are big gaps. So understanding the needs, understanding the demands of elderly people, the challenges they have in navigating the system to access care, how their level of health literacy affects this. These are all areas that there are quite big gaps in. And in fact, it's an area of interest of my own. So I would say that given what you've just outlined, I would say in our population health services research unit would be probably a good fit for you. And we do interact with colleagues in the School of Public Health in that area. So please feel free to follow up and we could maybe give you a bit more detail on that.
Thank you for that.
You're welcome.
Great. Thank you very much, Professor Ellen. So I think we've come to the end of this session. Thank you very, very much for a really interesting and insightful talk. I learned a lot, and it's fascinating the work that you're doing in the School of Dentistry.
Great.
Thank you.